the way that the program, it's called InSIGHT, the way that InSIGHT is set up is that we do 2 weeks of like community work and then 2 weeks in the Patton Academy of Health Sciences. So I was on the pediatrics ward for 2 weeks after our 2-week community placements. And I found that when we were in the community, we were learning so much about like cultural context and laws and how healthcare is delivered in different settings. Like we went to a rural community to see different health posts and the health services that they can deliver in different ways, and kind of the challenges of living especially in the mountains where the roads are kind of difficult to traverse. Especially, we went in the monsoon season, so it was very rainy. And the roads, we had some trouble getting to some of the communities sometimes because the roads were a bit washed out. And then you can imagine, like, if someone gets sick in one of those communities, they have to drive 3 or 4 hours to get into Kathmandu and then to receive health services that they couldn't be provided in their community. And then when we got to the hospital, you can take all of those lessons that we learned in the community and apply them to the patients that we saw. So it's really interesting to see, or like to talk to the patients and read their charts and think, okay, this person is from a small community. It's probably 3 or 4 hours away from here, and like think about how difficult it was for them to actually get to the Patton Hospital and actually receive the health services that we were watching being provided. So it really helped contextualize some of the things that we were seeing in the hospital, and even the way, like when I was reading through charts, you can see sometimes like a very detailed social history, and it would often include like the ventilation of people's homes and how large and how kind of crowded the home was, and that was to assess tuberculosis risk. Because there was a lot of respiratory issues. They needed to know whether the child had been exposed to someone with active tuberculosis, and if they were living in a crowded area, it's more likely that you're going to pass TB around. And then we also used to see on charts like what type of water people were drinking. It was like tap water is sometimes contaminated with different bacteria and can cause GI disorders. So if it was noted that the child had been drinking unfiltered tap water, then they would monitor for different GI conditions as well, and it could also help explain why they were sick in the first place. So it was really interesting to see the way that like the social context that we had seen in the community was incorporated into the way that the patients were being treated.